Ladies and gentlemen, announcing Marcus Allen Kinney, Secretary of Health and Human Services for the Trump administration.
Good morning, my fellow Americans. May I start off my speech by giving thanks to President-elect Donald Trump for nominating me for the Secretary of Health and Human Services, along with giving thanks to the Senate for accepting my nomination. As your new Secretary of Health and Human Services, I plan to make several changes of the way our health is managed in this country. And those changes being, I plan to provide advancements in the health in our American citizens by making affordable health care for everybody, for every citizen. I also plan to improve the technology we use in healthcare so that we can have faster recoveries and less incidents in our American hospitals. Finally, I want to invest in acquiring a bigger workforce along with more hospitals so we can always have an adequate amount of hospitals that we can use in our country. My first topic, I want to start off by saying I don't dislike Obamacare. I just feel that it wasn't executed properly. I like its intentions, but they could have been executed a bit better. Sorry. First off, I've read many articles saying how many poor Americans commit small, meaningless crimes so they can go to jail and so they can get free health care. I do not believe in an America where poor people have to commit crimes just so they can get free health care. I believe that health care should be available to everybody instead of those who can afford it. Next, I believe that Americans should not have to pay a tax, so if they don't have health care during tax season. I do not believe you should have to have health care just in order to be exempt from paying a tax when you're filing your taxes. That should not be a way America works. I want to restate my first topic by stating that I do not believe Obamacare is bad. I just believe that its intentions were not met adequately. Another big topic I want to improve as Secretary of Health and Human Services is the fact that I want to improve the technology we use in our health care. Reports say that about 200,000 people die each year from medical mistakes in our hospitals that can be prevented, but are not. Medical mistakes are the third leading cause of death, right behind heart disease and cancer, and I believe should not be that high and I believe they can be prevented if we just improve the technology we use. I also plan to help doctors fight diseases by helping them discover new cures and new operations available to help many people who suffer from diseases and medical injuries. The third change I want to make in our healthcare system is the fact that we need more hospitals and experienced doctors. In the past couple of years, there has been a decrease in the number of hospitals and number of rooms we have in America, and this should not be happening as the population is increasing. If the population continues to increase, excuse me. If the population continues to increase, we continue to see a decrease in the number of hospitals we have. Sooner or later, we will not be able to meet the standards, and we will have to start turning people down at hospitals. I do not believe in an America where people get turned down from health care just because we don't have a proper number of rooms. Finally, to restate my 3 topics, excuse me again, sorry. To restate my 3 topics, I believe that I want to change the way Obamacare is run because I believe it is a good system. It just wasn't executed correctly. I also want to improve the technology we use in healthcare so we can see more technology and see more cures for diseases and less incidents happen in our hospitals. And I want to increase the number of hospitals we have to make sure no one will be turned down at hospitals. I want to thank you all for coming and listening to my 3 topics, and I want you to have a good afternoon, my fellow Americans.